Hepatitis C is a blood-borne pathogen. It's a virus that is transmitted from person to person by way of blood. It is actually fairly common in the United States. It probably affects on the order of 3 to 4 to 5 million people. In the world, it affects 170 million people. The reason hepatitis C is a problem is because in a proportion of individuals, it can cause inflammation and scarring and lead to the development of cirrhosis and liver cancer and liver failure. That doesn't occur in everybody that has hepatitis C, but it occurs in enough people that it creates a big health burden. So hepatitis C, once you contract it, can affect the liver right away, but it doesn't affect it in dangerous ways right away. We have many patients that first contracted hepatitis C, by the best we can tell by the epidemiology of their particular situation, maybe 20 or 30 years ago. And they may have very mild disease now, but they can also have cirrhosis at this point and have all these complications that come from that.
Because hepatitis C doesn't cause any symptoms until it's too late, until it's very advanced, we feel that the best way to know about it is to get a blood test. The CDC recommends testing, one-time testing, for all baby boomers, those born between 1945 and 1965, because in that group is where the largest number of individuals with hepatitis C are. So those people should just say to their doctor, I'm in the baby boomer age group, I need to be tested for hepatitis C. But in addition, folks who may have had a blood transfusion prior to 1990, may have used injection drugs sometime in their life, even if it was 20 or 30 years ago, had an organ transplant, have close personal or intimate contact with somebody with hepatitis C, or had an organ transplant. Those are individuals who are at risk of hepatitis C, but more important, I think, is this recommendation for people who may be feeling quite well, but who fall into that age group where it's recommended they be tested.
I think there are five different regimens that are approved by the Food and Drug Administration now, with various combinations of what are called direct antiviral agents, DAAs, that don't involve the use of interferon, don't involve shots, very rarely have any significant side effects, and are effective in curing people with hepatitis C over 95% of the time. So we have high efficacy and low side effects, and we only have to treat patients on average for 12 weeks. So we treat them for a short period of time, they don't have any real side effects, they do very, very well, and the vast majority of these patients get cured of their hepatitis C.